Welcome back to WKRG News 5 at noon, and the doctor is in. Today we are joined by Dr. Trevor Stubbs. Thank you so much for being here this afternoon. He is an orthopedic surgeon with Bayside Orthopedic Sports and Medicine Rehab. And today we're discussing something so many people deal with at home at one point in their life, and that's knee pain. I know I deal with it. It's not fun. So if you, for our viewers that might have knee pain, what is the most common reason for that?
Absolutely. Thank you for having me. I really appreciate that. So certainly that answer depends on the patient's age. For most adults and for, especially as we get older, knee arthritis tends to be the most common thing that we deal with. It's typically pain and soreness around the knee. It gets worse with activity. Patients can also have stiffness and soreness, especially after activity or after being seated for a while. And this typically comes and goes and gradually gets worse over time.
And you mentioned arthritis. We hear about arthritis all the time. What exactly is it?
Yeah, so arthritis at the basics is a lack of cartilage. And so as we get older and the cartilage wears down, that starts to cause issues with range of motion and pain and swelling. You can see on this image on the left, the cartilage is nice, shiny, white, and smooth on the ends of the bone. And there on the right, as it wears out, it starts to cause more friction and cause pain.
So what can people do to prevent knee pain or problems in the future? Is there anything that they can do to prevent that?
Knee prevention is incredibly important, and weight control tends to be one of the most important things that we can do. Kind of the less weight that you have, the less force that you're putting across the knee joint. Other things are staying flexible, staying strong, and certainly considering low-impact activities like swimming and biking and elliptical machines, as opposed to high-impact activities like running.
And so what can viewers do that have knee pain but aren't interested in getting surgery?
Yeah, well, I think it's incredibly important to have a good idea of what we're dealing with and what we're treating. Some of the common things that we use are rest and activity modification, ice, medications, bracing, physical therapy, and sometimes injections. But it's really important to know what we're treating to be able to make a good plan to treat that.
All right, and thank you so much, Dr. Trevor Stubbs, again with the Bayside Orthopedic Sports and Medicine Rehab, and he will be joining us live on Facebook Live here after the noon show finishes.
Now.